I think we have been very cautionary of opioid use nationally in the UK itself, because we've seen how this has become such a major problem in the United States. We've seen various Netflix and social media pieces of the dangers and the problems that opioid misuse, abuse and diversion have caused, not just to the patients themselves, but also to their loved ones and to the family and society itself. So I think we need to make a concerted effort in the UK to avoid such a calamity from occurring. And we do know that of all the areas in the UK, the northeast region has been more at risk because of a variety of factors relating to social determinants of health, but also in terms of the prescribing of medications as a easier or a quicker fix. So it has meant that the northeast and North Cumbria region has had a much higher prescribing of opioid and harm due to opioid use, and predominantly opioids are prescribed for chronic pain. So I think it is about time. This is happening nationally, but it is even more important in our area to focus on raising awareness about chronic pain, raising awareness about the harms caused by opioids, and giving healthcare professionals and patients with pain an alternative framework of not being dependent only on drugs, but coming up with other options to manage pain successfully. So my background is as a consultant anesthetist with the Royal College of Anesthesia and the Faculty of Pain Medicine, and my fellowship at that time when I was doing anesthesia was in pain management. And as anesthetists, we've always been very good at relieving pain using a variety of techniques in the hospital. But I also realized that there are so many parts of pain management, chronic pain, that are fascinating to understand. The research is really exploding in terms of newer ways to understand pain, and the neuroscience aspect has been so compelling and exciting. And so I've realized that actually, in order to provide a more holistic appreciation and pain management, I needed to get more interested in everything that was pain related. And I think that's where my passion for understanding, knowing and helping people with pain came from. I think one of the most important things we need to start talking about is that chronic pain is not just an extension of acute pain. We need to be raising the awareness and the message throughout the system that chronic pain can be managed without drugs, and that we now know enough about the various factors contributing to chronic pain, and that we can address them as a system, and that would mean we don't have to be reliant only on medications. There are so many other well-evidenced alternatives that we can provide our patients with, but that fundamentally starts by understanding that not all pain equals harm. Sometimes the brain, in its attempt to be overprotective, can present a pain experience, and that knowledge itself can be very liberating and protective for the patient. This is a topic of change and implementation that is very close to my heart, and it is the subject of my research as well, into saying how do we bring about change, not just in our patients to think about other alternatives to pain, but also in healthcare professionals to give them the tools so that they feel more confident in looking after patients in pain. So behavior change at that level, habit change, using the principles of neuroplasticity and what we now understand about how the brain learns, about how the nervous system can be desensitized, is very important for not just one healthcare professional or a clinician to know, but it is actually for the entire system to know, so that we give a common message to the patient. Because what we now understand is that for any behavior change to happen, we potentially need about an average of 7 touch points, meaning that a person will have to hear the information in possibly 7 different ways, through 7 different people maybe, and in different mediums to actually start thinking about change and making change. So we need to have a whole village singing the same hymn sheet, so that we can start to bring about change of any kind. And for pain especially, that I think should be the way we should think about evoking change.